YouTube fam, how are you? Tiffany Robinson, aka Coach Tiff from Beyond RCM, and I am so excited to jump into today's mini masterclass. So my newbie community, you guys are going to be very excited about what we're going to talk about. I have gotten your comments. I know that you guys wanted me to get on here and do a RCM related topic, so you're going to get that today. But before we jump into that, I want to welcome our first time viewers. My name is Tiffany Robinson, aka Coach Tiff, and I am a healthcare professional with over 25 years working in the healthcare industry, primarily in the business office. And Beyond RCM is a YouTube channel that is designed to talk about all things related to healthcare. So we're talking about what's in the news related to healthcare. We're talking about evolving topics that matter to the clinical and administrative side. We're talking about individuals who may be dabbling and thinking about getting into the healthcare industry. We talk about why this is a great industry to work in. We also talk about, individuals who may be wanting to open their own business. So first-time entrepreneurs, whether you're an entrepreneur on the business side or whether you want to open your own medical practice as a medical provider, you're going to learn things here that they're not going to teach you in medical school. So if these things sound like topics that you are interested in and this is your first time joining the channel, I want to say welcome, but I want you to come back. So be sure to like, subscribe, and hit the notification bell. So every time we put out new information, you will be one of the first to know. So today, for our mini masterclass, we are going to be doing a crash course on Prior Authorization 101. Now, what exactly is prior authorization? Well, there are two different schools of thought when it comes to prior authorization. There's the insurance company's perspective of what prior authorization is intended to be and function as. And then, of course, you have the provider and the clinical side of things because they're the ones that actually have to deal with it and deal with the insurance companies. And oftentimes they tend to butt heads. So let's talk first about the insurance company. From the insurance perspective, prior authorization is a mechanism that is designed to ensure that services being provided to their members meet what is called medical necessity. And initially, when prior authorization was introduced, it was intended to ensure that more costly procedures, so procedures that tend to be more expensive, we're talking MRIs, CT scans, etc., that these type of procedures were appropriately screened and that patients that were receiving these services, that they met the criteria for medical necessity. Insurance companies wanted to ensure that these services would not be overutilized and abused. So that is the insurance company's perspective. As someone who has worked with medical providers for over 2 decades, I will tell you that many medical providers feel that prior authorization is no longer being used in the manner for which it was originally intended. Case in point, you now have certain payers that require prior authorization for services such as an office visit. Now, when you look at an MRI or a CT scan versus an office visit, those are two totally different type of services in terms of complexity. So many medical providers feel that there are services that now require prior authorization that should not even need prior authorization to begin with. And it causes an undue burden to their practice when they need to see their patients and they have to get approved for something as simple as an office visit or something as simple as an ultrasound. So two very different schools of thought when it comes to prior authorization. But the fundamental purpose, according to the insurance company, is to make sure that the services being provided are medically necessary. Now, when it comes to which specialties in the medical field require prior authorization, you will find that there are certain specialties that rarely require prior authorization, and then there are certain specialties that often require prior authorization. And even thinking about my own professional journey, I remember working in OBGYN, obstetrics and gynecology, between the year 2000 and 2010. And in working in obstetrics and gynecology, the obstetrics portion of our practice often required prior authorization because these were moms who were pregnant, were going to have babies, and we needed to make sure that the maternity care was authorized, the delivery, as well as the postpartum care. Whereas On the gynecology side, we almost never required prior authorization. Another specialty that rarely requires prior authorization is internal medicine, family medicine. Those particular specialties, very rarely will you need to get your services authorized. On the other hand, you do have certain specialties that tend to often require prior authorization for their services. Another specialty that I worked in where we had to get prior authorization frequently was gastroenterology, for your colonoscopies, endoscopies, sigmoidoscopies, all that good stuff. Many payers require prior authorization. Other specialties that often require prior authorization is cardiology, and also some of your more expensive radiology tests that I mentioned a couple minutes ago. So you're talking about your CT scans, your MRIs. And again, these services tend to require prior authorization because they are very costly, and the insurance companies want to make sure that if the patients are getting these treatments, that their clinical history, their symptoms, and their projected prognosis rises to the level of medical necessity to approve these services. So those are just some of the specialties that you will come across that do require prior auth versus specialties that do not require prior auth. Now, the AMA reports that about 86% of medical providers feel as though the prior authorization process has become burdensome, and it actually creates a barrier to them being able to provide access to care to their patients. And what we're going to talk about today is we're going to talk about some of the best practices that medical practices and business offices can take to ensure that not only do their services get authorized, but also if anything changes in the course of treatment, what steps should be taken to correct the issue with the insurance company, and why it's better for you to correct it as soon as possible versus after the fact. Because I see a lot of these scenarios even in my day-to-day work life as a director of RCM services. So I want to talk about some of the challenges that many practices face when it comes to the prior auth process. The first challenge, obviously, is many providers feeling that there are services that should not even require prior authorization. So you have, there are over 11,000 CPT codes. You have an unjust amount of CPT codes now falling under the bucket of requiring prior authorization when many medical providers feel that these codes should not even require prior auth. The other challenge that many medical providers face is the process of getting the service approved. Now, every CPT code has a medical necessity guideline, a criteria. And just a little hint, many payers follow CMS guidelines. So whatever CMS tends to list in their publications, their LCDs and NCDs, as what they consider to be medically appropriate treatment, many insurance companies will also follow that. But then you will find that insurance companies will throw in a little something extra. And that creates a problem for many providers because there's no standardization. So although many plans will defer to CMS's medical necessity guidelines, they will also add additional criteria into their guidelines in order to approve the service. So you may have an insurance company like Cigna that has one certain set of guidelines, but then you go to another insurance company like Blue Cross Blue Shield or Fidelis, and their guidelines are slightly different. So it becomes very difficult for medical providers to set up a standardized process for their services because certain payers throw in different rules and guidelines in order to get that particular CPT code approved. So the first challenge is there's a lack of standardization. And because there is a lack of standardization, that often results in medical providers' requests being denied initially, and then medical providers having to go back and justify and substantiate medical necessity in order to get their services approved. So that creates a burden to the practice. Obviously, you're talking about medical practices that need to get patients in the door, make sure that they are treating these patients, monitoring these patients, and then once they determine the type of treatment that the patients need, they then have to go back and forth with the insurance companies to get the services approved. Another issue that many providers run into is following up and making sure that the services get approved in an appropriate time frame based on the patient's appointments. So, Dr. X may want to bring their patient in for a colonoscopy because based on the patient's symptoms, the patient is presenting symptoms that are indicative of that patient needing to have a colonoscopy to see what's going on. But if that patient's insurance company requires prior authorization and Dr. X has to submit clinicals and then has to make sure that the clinicals get to the insurance company and then has to follow up and make sure that the service gets approved. And then if for some reason something is missing in the clinicals and Dr. X has to then go back and have their staffs resubmit the information, all of that is happening while their patient is experiencing pain and discomfort and is not able to get the diagnostic testing that they need to make the appropriate diagnosis to start the appropriate treatment plan. So all of these different things that were designed to, again, make sure that the services meet medical necessity can often translate to frustration, not only on the part of the medical provider, but on the part of the patient who is ultimately experiencing the signs and symptoms and discomfort of whatever the underlying medical issue is. So those are, that's the main burden that many providers face. I did a video about maybe 2 or 3 weeks ago where I talked about an article that I read in New York Magazine, specifically about patients who were dealing with very serious medical conditions. We're talking about patients that were battling cancer, patients that were battling diseases that ultimately some of these patients that I discussed, they are no longer here with us today. They passed away from their condition, and patients just having to fight to get the access to the treatment that they needed. Some of these patients ended up having to pay money out of pocket just to get the service approved or get the service rendered so that they could get the treatment that they need. Now, obviously, that's not a realistic option for many patients. Many patients don't have the money to say, okay, I'm going to just pay for this and fight with my insurance company after the fact. So I do think that it is important for the insurance industry to really examine the prior authorization process, the services that they are saying requires prior authorization, and the process that they use to approve or deny these services. Because studies have shown that many of the processes that are used to approve and deny these services are algorithms, and they're not actual people that's reviewing the paperwork. So there's a lot of there, which this video would become a lot longer if I, stop to delve into it. But I do think that I'll probably put out a video in the coming months that touches on that particular process itself of how insurance companies actually approve and deny services, because it is quite fascinating and it's quite disturbing, to be quite honest with you. So now I want to talk a little bit about tips that you can use as a medical provider or as someone working in the medical industry on how to get your services approved. So just a couple of best practices. So the first thing that I want to recommend is if you're working for a medical practice and they are providing services that require prior authorization, you want to understand what are the medical necessity guidelines for those services for the payers that you guys do business with, right? So if you are a practice and you guys are, performing MRIs or CT scans, you want to, and you are working with specific payers, you want to make sure that you understand what are those payers' guidelines. What do they consider to be medical necessity in terms of the patient's signs and symptoms? What diagnosis codes? Believe it or not, there are diagnosis codes that insurance companies will not cover for specific CPT codes. And based on the diagnosis from the clinical side, you may feel like, well, clinically, yes, this patient needs this test, but if that diagnosis is not an approved ICD-10 code with that insurance company, they will not cover that code. So something as simple as understanding the diagnosis codes that meet medical necessity is something that is very important. Some insurance companies also require for certain procedures that you try other methods for a certain period of time before the service you are requesting is actually performed. So that means that your clinical documentation, when you are finally submitting clinical documentation for that procedure to be authorized, you're going to need to show that whatever other options the insurance company wants you to try, that the patient tried those other options and the condition did not improve, and that is why you are requesting the procedure that you are requesting. Another tip that I want to recommend is if you are a medical practice and you have multiple providers and multiple locations, you want to make sure that you're authorizing your services appropriately for the provider and the location where the service is going to be rendered. Because believe it or not, if you authorize a service under the wrong provider, technically that authorization is not valid. If you authorize the service under the wrong location, technically that authorization is not valid. So you want to make sure that things like your provider, your location is authorized appropriately. The other thing that happens a lot of times is you will authorize one particular CPT code, but then when you go in or a medical provider goes in to perform the procedure, they see something else and they have to change courses. So I'm going to give you a common scenario that I saw when I worked in gastroenterology. A common theme that we saw is providers would authorize for a colonoscopy with biopsy. So that is CPT code 45380. And the service would be authorized. But then once the medical provider went in to perform the procedure, they saw that the patient had polyps. And what started out as a colonoscopy with biopsy then turned into a colonoscopy with biopsy with a polypectomy. Polypectomy is 45385. And depending on where the polyps are found, you can bill for both the biopsy and the polypectomy. But if the plan requires authorization, you still need to go back to that insurance company and have your authorization updated. So a best practice that I want to give to my clinicians or my future clinicians is anytime you go in to perform a procedure and the procedure changes, that information should be communicated to your business office as soon as possible, or your billing department if you're a smaller private practice, as soon as possible. And the reason I say this is because it is a lot easier to get an authorization updated on the day of the procedure versus after the procedure has already happened. What insurance companies tend to do is if you have a procedure that changed and you call the payer back or you reach out to the payer after a day or 2 or 3 or more after the procedure was performed, that insurance company will likely not update that CPT code. What they will tell you to do is to bill the procedure that was performed. And once that service is denied, because obviously in many instances the payer will deny the service because the service authorized, the CPT code authorized is not the CPT code you're then billing for. And then once that happens, you then have to appeal the claim with medical records and justification as to why the procedure changed. And obviously that creates extra work and an extra burden on the billing side. And obviously it delays the provider being paid for their services. And that is just one of many reasons why medical providers take issue with the entire prior authorization process. But since this is the way it is today, my best practice tip is create a process, medical providers, where if you're performing a procedure and that procedure changes, that information is communicated to your business office so that they could reach out to the insurance company and update the authorization with the payer, preferably within 24 hours of the procedure being performed. I'm gonna throw in another bonus tip. Another bonus tip I wanna throw in is bilateral procedures. So bilateral procedures are procedures that are being performed on the right and the left side of the body, okay? And in many instances, when practices are authorizing bilateral procedures, they like to use the modifier 50 because the modifier 50 represents both sides bilaterally. You should only be using the modifier 50 if you're doing bilateral procedures and those procedures are being performed on the same day. The reason I say this is if you authorize a procedure bilaterally and you're doing the left side on one day and then you're doing the right side on the next day, in many instances, the insurance company is going to deny that procedure on the second day because they're going to say that you authorized the service with a modifier 50. That CPT code was already used on the first day, and for the second day when the patient came back, there was no authorization. So I recommend only using the 50 modifier if you're doing both lateralities on the same day. If you're bringing the patient back on a different day to do the left side and you're doing the right side on one day, I recommend authorizing 2 units, 1 unit with the LT modifier and then the other unit with the RT modifier, and requesting 2 units. Can you get it approved under the 50 modifier and perform both procedures on 2 different days? Yes, but you stand a high probability of that claim for the second service date being denied because that's just one of the issues, I'll say issues, that insurance companies tend to create when you use the 50 modifier. Yeah. Issues. I was going to say something else, but I'm going to go with issues. So that is pretty much it. That is our crash course today on Prior Authorization 101. I hope my newbie community, I hope you guys got a lot of useful information from this course. If you would like to know more about the prior authorization process, we do have a masterclass that is specifically dedicated to the prior authorization process. We dive even deeper into your understanding of this process. This masterclass is great for individuals who are new to the industry and want to get a great understanding, or even if you are a seasoned professional and you want to go for more of a managerial role and you want to understand the different components that make up the revenue cycle process. The masterclass is called Mastering the Prior Authorization Process. I'm going to drop a link to it in the description and you can find it on the Teachable platform. I hope you enjoyed hanging out with me today and you found this information very useful. Again, if this is your first time, don't forget to like, subscribe, and hit the notification bell so that when we put out new content, you will be the first to know. My name is Tiffany Robinson, aka Coach Tiff. I want to thank you for hanging out with me today, and I will see you all in the next video. Peace out.